Good evening, friends. Good evening, everybody. I'm Dr. Sitalakshmi, cosmetic dermatologist from OJS Aesthetic. I welcome you all to know something more about a botulinum toxin, generally called Botox. What is Botox? Generally, everybody comes and asks us about, do you do Botox? Yes, we do Botox, but it is not Botox. It is called botulinum injection. The process is botulinum injection and the brand name is Botox, and it has become popular as Botox treatment. Now, what is actually Botox? How is it useful to us? And why we use it so commonly in cosmetic practice? Let us see the introduction, how it has happened. Actually, botulinum toxin is a toxin secreted by a bacteria, and this has been causing a lot of toxic infections and poisons. And in the World War II time, it was called a sausage poisoning. Later on, they found that this is a neurotoxin and it can be administered to paralyze certain muscles when it is required. So this feature of it has been accidentally discovered and it has been adequately used in cosmetic practice. And now let us see how its action is. It paralyzes, it's injected into the muscle at the insertions or the origins, and it paralyzes the neuromuscular acetylcholine uptake. Thereby, it causes a paralysis of the muscle, weak paralysis, I should say. Therefore, the action is altered, and we get the desirable effect on the skin. Now, where is it used? Botox is popularly used for facial wrinkles, and there are various other indications also to use it. Now, what are these facial wrinkles where it is used? Most commonly, the face undergoes various changes due to aging and also due to our dynamic actions of everyday activities, either talking, frowning, laughing. All these activities do cause certain changes in the muscles and the skin and their dynamics. Therefore, there is a onset of dynamic wrinkles, that is, the wrinkles which appear while speaking, while laughing, or while doing a particular activity. These are called the dynamic wrinkles. And these dynamic wrinkles are caused because of the overaction of certain muscles, and therefore these muscles, when they are paralyzed, they give a neutral effect. So we see in the face we have different types of wrinkles and we name it in different ways. The facial wrinkles, when you use it, when you frown upwards as an angry look, these are called frown lines. There are also other wrinkles which are called the bunny's line. The nose, when it is fringed very much, then it is at the nose and the junction of the glabella, there are lines appearing which is called bunny lines. These are horizontal lines on either side of the glabella and the nasal part, upper part of the nose. There are also other popular lines which many people ask us for, that is the crow feet. They are the lines that are formed at the junction of the eyes, and when we actually close the eye or when we laugh, these lines become very prominent. These lines are called crow feet. Sometimes there are other smaller kind of lines in the papillar margin of the eye, and also these also can be addressed with Botox. There are other lines which form on the neck due to the wrinkling. These are the neck lines, or the very much hyper appearance of the lines that are the platysmal lines or the muscle. So how do we treat these things? Botulinum toxin is available as a lyophilized powder, and it has to be reconstituted to be used at a dermatocosmetological place, and they have to be certified to use this. Not everybody can do this. And botulinum toxin is especially used in the form of units. It's not in the grams. So there are a particular number of units that can be used for each indication. It's reconstituted and diluted, and these diluted things are given as a hypodermal or subcutaneous injections where the need be. First of all, we sync in line with the anatomy of the muscles, and we see that the activity of the muscles is true by making the patient frown, by making the patient laugh, and also do the bunny lines. Then it is assessed, and accordingly it is injected into the lines. Now, how is botulinum important in day-to-day life? Now, a young Is it used in the old people or is it used in the young people? The answer is anybody above the age of 18 who desire a particular look can use the botulinum toxin. And most often, dynamic wrinkles start in the age group of from the age group of above 18 to 40, 45 also. Wrinkles become prominent. These become static wrinkles, and static wrinkles cannot be addressed with botulinum alone. So the dynamic wrinkles are very important because when the activity is caused, the communication that the client wants to give to the others is disturbed. So when there is excessive frowning on the face of an executive, like a corporate executive who's doing a meeting, it shows that an angry look on the face. So this is not desirable. It is not dependent on the age. The corporate executive can be a young woman in their 30s and still there could be a frown lines. So when these are addressed, the action is immediate and within 48 hours, the action is seen. Similarly, crow feet are formed at the corners of the eyes. So these can be addressed with the Botox injection in the form of units, and within 48 hours, the action is seen. Now, to address other smaller facial wrinkles, sometimes we have the gummy smile, which can be addressed through the nasolabial furrows, and also sometimes we address the nasal flare. These are slightly advanced indications of Botox. Now you can see the before and after pictures in the videos. The frown lines, the bunny lines, the crow feet. Another very common indication for doing Botox is a brow lift. This is often named as Botox, a customary name given to the botulinum toxin. The eyelid also sides downwards as we age, and the people who desire an eyebrow lift can use this for lifting the brow. This is called brow lift. There are two important muscles that are raised, and this is called brow lift. You can see the picture of a brow lift. For the glabellar lines, there can be some vertical lines that can happen in the glabella. This is a central part of the thing. There is a muscles which are the frontalis and the procerus, which get attached over there, and this is the junction where you have to create the glabellar furrows and the glabellar lines. So these lines can be blocked with an injection in the procerus muscle. Also, some heads of the procerus can be blocked for the lift in the eyebrow. So concomitant lift is also needed. These muscles are very small and their insertions are into the skin and the surrounding mass. Therefore, injecting subcutaneously hypodermally can block these muscles, and give you the desired effect. So, advanced indications for the other advanced indications can be the pupil, under the eye in the pupillar margin. You can see some transverse lines sometimes, and these can be addressed with the 1 or 2 units of Botox, which will give a very relaxed appearance of the skin around the eye. Secondarily, you can address the platysma muscle, which becomes very prominent in some people, which can be blocked with the botulinum toxin injections. The other indications are the fine lines on the neck, which can be also blocked with 1 to 2 units of botulinum, which can be given in a very perpendicular areas. There is also another popular treatment which is for the face. This is called mesobotox. Mesobotox is given with diluted amounts of very few units of Botox diluted with other ingredients, and is injected very, very superficially into the skin, which causes a mild tightening sensation of the skin and also a glowing look. So Botox is very popular, and it is used as a party effect immediately before some function or function. So this is useful for an immediate glow. Its effects are transient, and as we all know, Botox is a temporary measure, and it has to be repeated if they want a continued look continued blockage of these muscles or the frown lines or the crow feet. Usually, the contraindications are very less, but if they are pregnant, it is not done. And people on blood thinners, especially, have to stop the blood thinners and they have to they have to be done at a later stage. Also, very rarely, there could be certain complications like developing the antibodies for Botox. It's a very rare event, but can happen. In those cases, probably the effect cannot happen. Also, it's also important to know about other conditions which can lessen the effect of Botox, like smoking or hypertension, which can lessen the effect of Botox. It's not absolute contraindication, but it can be cause a little lesser effect. Also, Botox is used for other indications like which I'll be dealing with in the next part. So, as we know that Botox is a necessary tool, it's very useful because there is no downtime. Can be used very effectively to decrease the wrinkling on the face and other parts of the skin.